Good afternoon, everyone. A very warm welcome to the Symposium on Public Health Research and Data Sharing. Now, as we all know, this is a topic that hasn't always been at the forefront of public appreciation or indeed public attention, much though it should be. But there is hope that the recent corona epidemic has served as a much-needed eye-opener in this respect. My name is Lydia Angerhand, and I will be hosting this meeting today. Now, I'm delighted to announce that we've managed to secure renowned expert speakers who will, so they've just assured me, very much enjoy giving us valuable insights into their respective subject matters. Now, before we start, ladies and gentlemen, a few words on the schedule of this meeting for your information. The first part will give you an overview of the essentials of health data sharing, such as governance, infrastructure, and interoperability, while the second part will introduce projects from all over Europe, illustrating how to put health data sharing into beneficial practice. After both these sessions, we're looking forward to a lively and fruitful discussion, for which the panel will be joined by a patient expert and a representative of a German statutory health insurance. And then, after the first discussion, we will have a short break of a few minutes. Now, some housekeeping notes. As always, you know the drill. Please use the chat button at the bottom of your screen to submit any questions you might have, with your name or without, anonymously. Both are fine with us at any point in time during the session, and we will be happy to read them out during the discussion. So do please keep those questions coming in. Also, please be aware that we will be video and audio recording this session. I would like to take this opportunity to thank the Fraunhofer Institute for Applied Information Technology for taking over the patronage of this very special event. Martin completed fellowship programs at Harvard Medical School and the Dana-Farber Cancer Institute. These days, he is head of personalized healthcare in medical affairs at Roche, Germany, and focused on bringing innovation to cancer patients. Noch einmal ein Grüezi in die Schweiz. Martin, what can you tell us about health data sharing? Go on.
Thank you, Lydia. And good afternoon to everyone. On behalf of Roche and on behalf of all my colleagues at Roche that have greatly contributed to what I'm about to tell you now, I feel really humbled to give you a short glimpse of why we're so excited about the European health data space and why Roche is so committed to help establish and help position Europe as a leader in the data economy. So we believe that every single patient has the right to get the best possible care, to get the best individualized care, the best personalized care. And data will certainly be a key enabler for us in order to achieve that. So the question that remains is basically, when you look at the title, like, how do we really unlock the full potential of these data? The next slide, please. So on patient level, we have two major developments. On the one hand, we have a wealth of data that is being generated at every point in the patient journey. So that is at diagnosis or during treatment. On the other hand, our capabilities, our ability to generate insights at scale is also rapidly accelerating. So everywhere, there are all these touch points at diagnosis, at treatment, during screening, and hopefully in the future also in the course of prevention, we have the potential to get data that will transform patient lives forever. And there is something that we can realize with that, something that is unbelievably important, and it is the democratization of healthcare. So that means that patients have the means to take charge of their own well-being. Next slide, please. So if we're looking now at the bigger picture, so more like a systems perspective, we need something. We need a system that is telling us, how are we doing? So every single time we're diagnosing a patient, every single time we're treating a patient, there has to be knowledge generated. There has to be some sort of improvement in the precision that we treat, so that we have a knowledge feedback loop, or in this case, how we call it, a learning healthcare system that iteratively makes us smarter, makes us better, and helps us to close what I would call is kind of a virtuous circle, which means that the data that originated from the patient now come back to the patient in shape of better outcome, improved access, or higher precision in care. So the more we connect data and work together to do that, the more we take care of interoperability, the more we will contribute to what you see here, this learning healthcare system. And the most important part is that if we have that, we can move away from kind of a touch and go medicine, from kind of a pit stop kind of care towards a more integrative, more holistic, more seamless management of patient health. So the sharing of data across borders will certainly help us to address some of the challenges, but the real value of data will be their reuse and the use across all stakeholders in the ecosystem. So I think everyone here today would agree that this is not a question of whether we should do this, but rather what can Europe do to catch up or maintain with or keep up with these developments so that we can establish and continue to have prosperity in the 27 member states. So Roche, together with all stakeholders in the healthcare system, is fully committed and has a clear interest in the European health data space, and that it delivers not only for patients, but also for the member states. And with that, I look forward to a great discussion and a dialogue with all of you on this exciting and relevant topic that will shape our future. Thank you.
And thank you, Marty, for these insights into the development of a smarter healthcare, something I'm sure we can all agree on. Presented, and what better way to do that than in a panel discussion? As mentioned, for this first round, I have the pleasure to introduce two additional members. First, Birgit Bauer, digital health and social media entrepreneur who is involved in a wide range of patient expert and patient advisory groups, and Andre Bredemann, a pharmacist currently heading the medicines department at the German Barmer Health Insurance, where he is responsible for contract activities and ordinance management. Hallo Birgit, hallo Andre, herzlich willkommen. Very happy to have you both with us. Just as a general information to the entire panel, if you would like to join in, just raise your hand and I will see you, and I will hand over the mic to you virtually, of course. We are on quite a tight schedule. We've got lots of interesting stuff to go through. So if you could just keep your answers as snappy as possible, and we will get through hopefully a lot of questions. And if I have the feeling that somebody's speaking for too long, I will ruthlessly cut them off. Now, kick it off with the general topic of health data sharing. Birgit, if I may start with you. We've heard a lot about public health research, health systems, working together, public, private sector. But at the heart of it all is, of course, the patient. So where do you see the value of health data sharing for an individual patient, for a group of patients? What can you tell us on that?
I think it's an important thing to share data because we can have maybe a better care, also better treatments and services. And I think this is important, and also data sharing. And as Joanna mentioned before, when I'm going to another country, I can share my data also with other doctors if I have an emergency. As I'm living with MS, it can happen at every time. And to know that there is a doctor helping me in the foreign country and he can help very fast without asking me many of questions, it would be great.
Yeah. So, Andre, you're next up. We've heard from Birgit now how important it is for data to be shared for very, very crucial care. So what did you say a role that a health insurance company can play in patient education regarding the whole value of public health research, how it can affect them, how it can benefit them? Are there any learnings from COVID we can take? Andre, please let us know.
I think it's without a doubt that we need health data sharing as a crucial factor for improving the healthcare treatments today. And I think Bettina Borisch has mentioned it in her presentation when she used the term techno-political knowledge. And in this term, there is mentioned that we have to get into a communication and a dialogue with all relevant stakeholders. And I think one very relevant stakeholder is the patient itself. And we need to create a bigger acceptance, a bigger popular and perception for the benefits, systemic and individual benefits for healthcare sharing in this circumstance. And this is what I like to emphasize in this discussion. We need to concentrate on the patient's acceptance in these circumstances.
Mm-hmm. Bettina, you were just mentioned. I'll just hand over to you. And COVID-19 has been mentioned a couple of times now during all the talks. Would you say that COVID-19 has acted as a very big catalyst for the digitalization of health? How big was the influence of the pandemic? Question of big data. What has changed since COVID, since Corona?
I think the first thing COVID did is showing us pre-existing problems under a magnifying glass. The inequities, the non-existing digitalization, the gender inequalities, everything has been magnified. So we have a kind of awareness of things we have to work on. I think that's a good point. And the thing is also that COVID has perhaps created the awareness that we are in it all together. I think that, as I mentioned, even now, the vaccination will tell us that we will never be out of it without everyone having access. If it comes to data, Madame Gilgore mentioned it as I did. We see if we want to travel next summer, we want to go, then we need data. We have to share them. Not only do we need them, I do live in Switzerland. Switzerland starts to discuss an own passport. But the next question is, will that be valuable and in the EU? I think we have learned these two things. We need data. We need to look at how we create them, how we exchange them, and what governance we will put on them. Because again, already with a passport, what should the passport allow? Every country will have an ethical discussion if the passport allows you access to football stadiums or if the passport is only there for traveling. So I think that COVID has done a lot. And those who tell me, oh, people will return to the normal, I say, first of all, it was not normal before. And second, there is a learning going on quite silently because things change. Now we are sitting here in digital space. We would not have done that beforehand. People are working differently, and all this changes very smoothly. And again, for health, I think it has made us understood how vulnerable we are. The idea that the virus happens in Wuhan or in Bergamo, we got over it. We are all in it together. And I think that's something that's important for citizens. And I talk to Ms. Bauer, all of us. It's not only patients, we are citizens. We are all exposed to a coming disease. And we know the next pandemic will come. So I think the learning is quite important if it comes to health data and health systems.
Mm-hmm. So as you mentioned, we're not all citizens, we're also all potential patients. I mean, each and every one of us, that's just how it is. Markus, I saw you lifted your hand just now. What would you like to add to this question?
Yes, regarding the COVID data, I think within the last year, many of us waked up in the morning and the first thing we checked was health data. So I think it has really brought up the importance of health data. For example, how many people have been sick the previous day and so forth. Also, I think I would like to highlight that people probably have understood within the last year that health data is not only individual data for the patient. I think it's also the public interest that has really raised, as Bettina said, it's for us all. So I think this is some message that we also need to bring, that the health data is needed for the society, for the better treatments, and we need to find better ways of using that. And COVID has learned that it's very important. So I think that is one lesson learned.
Yes, as you mentioned, it's very important to get into football stadia these days. The Germans made it very exciting yesterday. Thomas, if I just might hand over the baton to you. We've been talking about how important it is, how beneficial it would be to all of us, but also IT, data. We always talk about data security, data protection. What is your thought on the importance of IT infrastructure for linking data protection? How can data be secured? Who is allowed to use the data? You already mentioned that in your talk. But how would you convince somebody that the data are secure? Because I think that is a big fear within the general population, even if they are on Facebook and Instagram and everything else.
Yes, so I think first of all, we need some transparency of that process, and that's why the governance over the IT is very important, to have, let's say, both institutions that are credible to do the governance. But as I said, the transparency. So we need to have security experts. We need to have patients look into those processes, how they happen, to be convinced that we take the right measures. And I think if we do that in a sort of more centralized fashion, like in a Gaia X infrastructure, in a complete network of trust, then people will slowly accept that we can actually implement the security, and it's not, let's say, an obscure hole in which all the data are put and nobody knows what's happening with them. So transparency, I think, is a very important thing. And of course, a second argument will be that our experience is that, for example, chronic patients are, let's say, much more willing to have others work with their data because they can immediately see the profit, while many of the skeptics are people who are, let's say, still very healthy and really haven't experienced, let's say, how data can actually help them. So we probably have to deal with these different groups, and we can't convince all of them at the same time. But let's say once they get into chronic diseases, I think you get them anyway.
But if you could talk about that, Birgit, I remember one of our talks, you mentioned that it's not just patients. It could hit any of us anytime. And I think you mentioned the example of having an accident somewhere in Europe. And if you could just have a card, that would help. You were talking about that, weren't you? That is for the general public as well, not just for people with a chronic disease.
First, I want to agree. Chronic patients have more open minds to share their data because they expect maybe a cure, better care, whatever, and they know exactly what the benefits can be when they share their data. And yes, the other thing is when you're on the German Autobahn, which you can drive very fast on, it can happen that you have an accident, and to let the people know what you have, allergies, diseases, whatever. You have the possibility to have a better and faster care. And sometimes this can save lives.
Absolutely. And talking about saving lives, Marty, we've talked about this in advance as well. We're all of us either in the process of getting vaccinated or we are already vaccinated, and then yoo-hoo off to the beach in summertime. And of course, we can only do this because of the efficiency of research and development in healthcare. So could you give us an overview how data sharing can even improve that even more?
Yeah, happy to. So I think if we really want healthcare systems that are truly transformative, I think it's non-negotiable. It's something we need, a data source that is robust, that is large, that is secure, and that is unified. So the private sector has to come together with the public sector, and we have to really exchange data. So then we have a real shot, I think, at the European health data space. Why is that so important? Because if we share data, we share knowledge, and most importantly, we share experience, right? Otherwise, we keep doing the same thing all over and over again, hoping for a different outcome, and that's usually not a good space to be in. And so if we get more precise, then in our understanding of what disease is, then we can say, okay, so this kind of therapeutic intervention is probably helping that kind of patient in that kind of context, with that kind of genomic profile, with that kind of comorbidity. So then you can imagine if we have a more precise knowledge for that, then enrollment in clinical trials is faster, accrual is faster, the trial will be successful, innovation can be delivered. to patients in no matter of time at all. So that goes back with the vaccination example. And if I may make one more point, as we become more precise, of course, also the patient segments become smaller, right? And then other nations have a huge advantage. China, 1.4 billion people, United States, 320 million people. And if you have a rare disease, let's say with 0.1% frequency of oncological disease, where you have, let's say, 1.8 million newly diagnosed patients in the United States, you will still end up with 1,800 patients where you can ask the question, okay, so how are they being treated in routine clinical care? If we try to solve this on a state by state basis within the European Union, we're not going anywhere. So my plea is that for the European health data space, we need to come together as 450 million people in order to solve this.
Mm-hmm. Talking about sharing, learning, we've just had a question in from the audience, and this is for you, Thomas. The question is about federated learning. Is it the solution to the ethical and legal aspects of data sharing? Is it a solution, Thomas?
I wouldn't say it is the solution to this problem, but it will greatly aid in acceptance of these kind of things, because according to the data protection legislation, I mean, federated learning is a secondary use as any other access to the data. But clearly, I mean, if you have only a checked algorithm working on the data, it's much easier to make sure that there's no leakage than if, for example, you have to copy the data to another unit, to a hospital or whatever, where maybe the security measures are not perfect and the data, let's say, are used as they should not be used. So it makes things somewhat easier. It should also be easier on the governance procedures. And it should also be easier on using this by the medical specialists, because they are not data scientists, so they are not basically trained in collecting and harmonizing data. But if they can use these kind of tools, and that is the hope, they can more quickly, let's say, leverage the resource of the data that we have without actually transporting the data. And one of the things, for example, is in Germany, many hospital laws say the data may not be transported out of the hospital, which of course is weird if you want to share them. But I mean, this would be legally one way of not transporting them out of the hospital, but by just processing them inside. But you can aggregate the statistics and you can find, let's say, genomic variants across several hospitals. So yeah, it makes things easier, but of course it's not the solution.
It's part of the solution. We have another question from the audience. I would put this to Markus and to Bettina. Maybe Bettina, you first. Is there any publication, papers, studies you are aware of which describe current and prospective data usage in health research, such as data sources or data type? So I'm guessing the question is, what is the evidence that we have at the moment, and are people producing papers on this?
Yes, the amount of data is there. I cannot start to tell them, but I would be able to give. What I feel it's also interesting is that there is literature about the ethics behind it, because this is another question. And some of my thoughts come, for example, from a Danish professor who is working on looking at how science technology goes forward. And we are in medicine always in a moving target, and it's important that society keeps its eye on the developments. And there's it's a large body of literature, but I'm happy to share with the person who asked if needed.
Very good. And Markus, your thoughts on that? Publications describing data sources, data types?
Yes. In Finland, we have this metadata catalog listing the different data sources in Finland. And the Data Governance Act that the European Commission published last November requires each country to set up similar catalogs that you then find out what are the data sources. Also, a European project led by Cienzano in Belgium published a EU portal for listing different data sources in Europe. So these kind of metadata catalogs are available. If you want to know for what purposes data has been used, I don't know from other countries, but in Finland, in the next session, you have FinData director Johanna Seppänen telling how data is used in Finland, and they list in their website findata.fi all the studies that have received data from Finland, because they are the permit authority for Finnish health data.
Okay, well, I hope that answers the question to the audience, and it is perfect timing. May I just say that we have 5 more minutes left, and our thought now was to give you one more question to each and every one of you, saying what is the most important priority to unlock the potential of health data for the patients, for society, and what would you say the key action points are? And I'd like to start with you, Birgit. Your thoughts on that?
The most important priority is to open the health data space and to give data also back to the patients. This is something we have to do too. On the other hand, I would say it's most important to generate trust, to cooperate, to be in the dialogue and have that discussion with the patients, not just with the patient group, with all patients and all citizens, because this discussion must be there and must be ongoing. And what I also would say to unlock the data is information. So we are talking a lot about the European health data space and all that systems, but nobody explains it to the citizens. Why? I think we need more information, education, and we have to reach the people no matter where they are.
Okay, thank you. Bettina, your thoughts on the key projects, the key issues?
I would directly add up. That is very, very nice that you said it. I think unlocking, we need trust, we need transparency, we need the dialogue, and we need all together define the goals and values behind the data, because that's very important. What for? Why? And then make it known. And how to make it, I call it, we need a new social contract. And I think Martin Hager said the democracy in health sector is the most undemocratical part of our democracies, I think. So we have to have an open discussion about a social contract that is not between political parties, between all citizens, and say, what do we owe each other? Do I owe my data or my vaccination to my neighbor? These are very practical questions, but we have to sit and discuss it. So create a new social contract around health.
Mm-hmm. Andre, from the point of view of the health insurer, what are your thoughts on this question?
It's I can only underline the expressions. It's not an abstract discussion here. It's very patient-orientated. So therefore, we need patient-centered approaches to explain the individual and the systemic benefits for healthcare data sharing. And based upon the principles of data sovereignty and voluntariness, it is required to encourage patients to give their informed consent and commitment to these efforts. And perhaps they also need a technical interface to interact with this data space. And perhaps the German Gesundheitsakte electronic health care records, which is recently started, could be used as a central technical platform for this purpose.
Okay, Thomas, your thoughts, key priorities, key action points?
I'm a very pragmatic person, so I think we not only need to discuss it, we need to do it. And the best way to do it, and the only way to do it, is to have, let's say, focused but cross-border kind of implementation projects. Like, I mean, Genome.de now is a decidedly German project, but it's already linking with all the other European genome initiatives in the 1+million genome project. So we at the same time, we're implementing it in Germany, and we're thinking about exchanging with all the other areas. So I think we need more of that in other areas, because we really need to go down to the nitty-gritty detail, have patients and professionals experience all the little details, and then I think we can come up with a common understanding.
Okay, Markus, over to you. Your thoughts, key priorities, key action points?
Yes. I think key priority for us also be the competencies of Europe and the European innovators being able to bring the solutions for the citizens. Just yesterday I was in a panel where a European startup said that they went to US to get the data because it was not available in Europe. So what Martin Hager said, we need to be competent, we need to have solutions here, otherwise the solutions that we use will not be European, and then we all lose.
Okay. Well, thank you, Markus. Thank you to everybody on the panel. This concludes our first panel discussion.